Hello everyone, my name is Surina and about 2 months ago I moved from the UK to Australia to work as a junior doctor here in Brisbane. I've been here a couple of months, so I thought it was time to do a day in the life vlog. My morning begins at around 5:45 am with getting ready and making my morning oats, although inevitably I never have time to eat them, so they just have to come with me to work. Despite the bus stop being literally outside, I seem to miss it almost every day. Today, by some miracle, I managed to catch it, and so I actually managed to turn up to work on time for a 7 am start. I'm currently working in what they call a low acuity hospital called STARS, which stands for Surgical Treatment and Rehabilitation Services. Got that? It's super new and absolutely beautiful. I mean, I literally thought I'd walked into a hotel by accident on my first day. The NHS could never. Bizarrely, on a Monday, there are no patients on my ward. Being an elective day surgery unit, not much operating happens on the weekends, and most patients from the week before have been discharged. So unlike any job I've done before, Monday starts off fairly relaxed. This is great news for my oats and I, as we catch up on paperwork and admin. Seems I can't get away from e-learning modules, even 10,000 miles away from home. A little later, I get a phone call asking if I can assist one of the consultants in theatre, and I very happily oblige. Ready for theatre in 3, 2, 1, magic. Hello! So, I've just come out of theatre. We've done 2 or 3 thyroidectomies, so removal of the thyroid gland, which is up here in your neck. It is a breast and endocrine list, so the breast surgeons are also endocrine surgeons. It's it's a sort of joint thing in Australia. I think in England it's similar, but the breast surgeons I've seen there in my hospital were only breast surgeons, so I don't know how it works. Maybe there's different options. But yeah, it's a very busy day, which is actually really unusual. Like I said at the beginning, it's a day surgery unit, so it's a little bit less busy, a bit more straightforward than your traditional hospital where there's emergencies, acute presentations and things happening. I haven't got very long before I have to go back to theatre, so I will be eating. So reasons to take the thyroid out would be if your thyroid is overactive, so hyperactive thyroid disease, for example, Graves' disease, or if you've got a thyroid cancer that needs removing. Your thyroid glands are extremely close to your parathyroid glands, so when removing the thyroid, you are in danger of accidentally removing the parathyroids too. Your parathyroid glands release parathyroid hormone, or PTH, which acts on organs like your bones, kidneys and intestines to increase the calcium in your body. If you remove the parathyroids, you'll produce less PTH, and so your calcium levels may be low. Therefore, in between cases, I went to take blood tests from these patients to check their PTH and calcium levels were normal, suggesting the parathyroid gland was intact. If not, they would need oral calcium replacement. So the next 2 patients on the list are for breast cancer, so we're doing a wide local excision and I think a mastectomy, not sure, but basically we're removing the breast or some breast tissue as treatment of breast cancer. And that's what I want to do. I want to be a breast surgeon, so I'm very excited. I won't lie, with the thyroid cases, I was very much just holding the retractors until my hands were cramping and I couldn't feel them anymore. So I'm hoping the breast cases will be a little bit easier on my hands and perhaps I can do a little bit more, like some suturing, but I haven't got very long to eat, so check in with you later. Destroying my fruit salad as if my life depended on it, I headed back to theatre for the last 2 cases. For the patient requiring a mastectomy, we removed the breast tissue and then closed the skin, and I was taught how to do some subdermal suturing, which was very exciting. We ended up finishing late, but having learnt a lot and being able to come back to this magical nighttime view definitely made up for it. The next day, I'm back at it again with the bus stop and the oats. I'm a creature of habit. We start with a ward round of all the patients on the ward who were admitted the day before after their operations. Afterwards, we get on with the ward jobs, which mainly include discharging patients and also prescribing medications for patients downstairs in the post-operative area who don't need to be admitted, but may need to go home with some prescribed pain relief to help their recovery. After that, it's time for some coffee, something we've had plenty of time for on this rotation. After we finished chatting in the doctor's office, finishing discharge summaries, we head down for a quick lunch in this beautiful food court. Yes, that is a sushi restaurant and a boost bar within the hospital. After this, I wander back down to theatre to discover new ways in which I can be more useless. Hello friends, so just scrubbed in for a general surgery case. It was a reversal of an ileostomy. Can't speak today. Reversal of an ileostomy. So this patient had a perforation of his bowel about a year ago, secondary to diverticular disease. So that's when you have sort of pockets of bowel outpouchings, which can sometimes just exist with no issues, but sometimes can cause symptoms and sometimes even cause pieces of the bowel to burst. Essentially, you need to give some time for the bowel to rest when something like this happens because it's quite inflamed. So you bring a piece of the bowel out and form a stoma, and then at a later date you can reverse it and put that back in and join the two bits of bowel back together. So that's what we were doing today. I didn't get to do too much suturing, but I did get to use a ligature, I'll have to look that up, which is a sort of heat gun kind of thing, which cut off the pieces of the bowel that we didn't want anymore. And then I got to use this big staple gun to join up the pieces of the bowel that we do want back to one continuous loop. I got to help out a bit, which was fun, and the surgeon was quite nice too and was teaching me, although he didn't call me by my name, he just called me Junior the whole time, but he was perfectly nice, so not too sad about that. Yeah, so that's pretty much brought me to almost the end of my day today, so catch up with you another time. Before leaving, I quickly pop on the ward to check all the post-operative patients are okay, and then that's it, that's the end of my day. So thank you so much for watching, I hope you enjoyed, and I'll see you in my next video. Very hard to film in hospitals.